everything you need to know when it comes to C-sections. Stay tuned, you're not gonna want to miss this episode.
Why? People always ask me, why do I prefer C-sections? The reason why, if you look at everything from, say, a business perspective, we'll just look at, you know, just absolute business perspective. The first one gets stuck, the rest are passed.
Yeah.
Everybody's dead.
Yeah.
So if you do a C-section, everybody lives. Yeah, you spend, C-sections, they vary based off of regions. You know, you can go to Oklahoma and get a C-section for $300-400. Where here in New York City, they cost what?
I would say you're paying at least $1,500.
They cost more where I live at. They're like $1,800.
I'm talking about minimum. I mean, if you go into an emergency vet here in New York, you can pay upwards. I've seen it as high as like $5K. So it all depends on, you know, where you go, the time that you go, things like that.
So, you know, I guess we should, business-wise, I tell people that it makes, because if you lose one puppy, that one puppy could have, first of all, could save the rest. Because if it was the first puppy, yeah, you're shit out of luck. If it's the last puppy, okay, you still have to pay a C-section to take out a dead puppy. That puppy, if you'd have just cut the dog open, would have paid for itself.
And just to backtrack, and you come from a breed that they mostly do.
I mean, no, my dogs give birth naturally. You know.
Yeah. No, that's what I'm saying. You come from a breed that they mostly do natural, right?
Yeah, I mean,
like the other breeders.
They're supposed to be natural. That's one of the things in my breed. They're supposed to be able to be free whelpers. And I agree, you know what I'm saying? If you know that a female can do it, that's, you know, it's a whole nother ball of wax. But if you don't know, and we're looking at things strictly from a business perspective is if you have 4 puppies, you lose 1. That's possibly a loss of income. Yeah. That loss of income could have paid for the entire C-section, especially if it was the first puppy, because now it kills the rest.
Yeah, yeah.
If it's the last puppy, it's a difference.
I'll speak on experience. I mean, this is something that, and I can vouch for Chris. We're not talking hypotheticals. Like, we're talking out of real experience. Like, I had a dog that I messed up on her timing, and I thought I had another day. I thought I had another couple days actually. I go in, and I'm like, man, she started giving birth. So I rushed her to the vet, and that first puppy that was stuck, he was like, you can kiss that goodbye. The puppy was stretched like a hot dog, and it was because, you know,
she was trying to push it out.
She was trying to push it out, exactly, yeah. And it was just stuck. So he was like, you can kiss that one goodbye. I'm going to, you know, I'll remove the puppy, but there's no saving that. And I was like, oh my god. And then what happened was, what was explained to me was that it's like they come out, you know, like one by one by one by one. So what happens is, because that puppy got stuck, it actually ruptured the sacs of the other ones. They couldn't get out.
Well,
so
she can tear her uterus by trying to push, and that first one is stuck. So she's pushing. So she could possibly rupture her own uterus doing so.
Wow. So that's a whole other thing. I mean, but like I said, like every puppy. So essentially, if the first one gets stuck, like in my scenario, the puppies all behind it died. Every single one behind it died. And I could have easily avoided that, you know, if I would have been better with my timing and got my C-section done. This was when I was very juvenile and very novice, you know what I'm saying, and just getting into progesterone testing. But yeah, essentially the sacs ruptured, and he said that, you know, they fill up and
drown.
They drown and they die.
Well, the other thing is, you get, like, for an example, you have a Borbal.
Yeah.
Borbal have very large litters.
She came from a litter of 16.
So that's what I'm saying. I don't know if people know that. So I don't know anything about giving birth because I'm a dude.
Yeah.
But giving birth 1 time is hard. Giving birth 16 times, I can only imagine.
I can only imagine.
Well, here's the thing. A lot of times when they have very large litters, they have what's called a calcium crash. And they just stop pushing. They give up. They just completely crash. They're done. You'll see them doing this sometimes. Their head will start shaking,
yeah, they get
or
the shakes.
Or they'll walk like they're drunk, And that's basically because their body is calcium deficient. Because you as a breeder, or you as the person who has the female, you didn't give them something like Tums or magnesium, calcium and zinc,
prenatal
stuff like that, to keep their calcium high, so when they go into that situation, they can have the energy to push all 16 of them joints up.
Yep.
So there is another reason why, all right, let's do a C-section, because one, let's not just tell everybody the good thing about C-sections. The bad thing about C-sections is sometimes there is an adverse reaction to gas. They wake up and they're extremely aggressive. It doesn't last forever. Sometimes they wake up and they have no motherly instinct because they physically did not birth a puppy.
Yep.
So you're holding a dog down, trying to make this puppy feed while restraining the mom. Now, I get it. This is a double-edged sword. Some people, you're going to have the people on the left side saying, oh, that's messed up. And then you're going to have the other side of the fence where it's like, this is smarter business-wise. So it's a double-edged sword, and people are going to have something to say about both sides.
Yeah, and I just tell people, too, like, the other thing when it comes down to getting C-sections done, I mean, some people will argue and say, well, I don't want the breeder, I don't want the dog if it can't have puppies naturally. You know, that's a fault, or whatever they feel about it. And I'm just like, I tell
that's
people,
their prerogative.
Yeah, that's
just like it's your prerogative to cut a dog and just be done with it.
Yeah.
You know what I mean? When I lived in Texas, I did have a really good relationship with my vet, and I could get a C-section on Christmas Day at 2 o'clock in the afternoon.
Yeah.
Not everybody has that.
Yeah.
So having a C-section on Christmas Day is very rare in this portion of the world.
Yeah, that's true.
I'm just being honest. I don't think anybody in the Northeast that I know of has a great relationship with a veterinarian. Where I had, I can't get a C-section on Christmas, but it's because my vet's Jewish, so I kind of. Yeah, but no. In all actuality, though, what I will say is like, well, two things. The first thing is I tell people also, I'm like, look at the percentage of women that get C-sections. You know, and so what would you say that because they can't naturally have a child, that they shouldn't have kids? You know what I'm saying? So I'm just like, and it's a large portion. I think at this point now, when I looked it up, I think it's like 30% of women get C-sections. Okay. So, but besides the point, like the Probal, let's use the Probal example, right? She came from a litter of 16. So what had happened was, I think 5 came out naturally, 1 got stuck. So now he lost all the other puppies. You know, he still had to go to the vet, get the C-section, and he paid the same price for C-section for dead puppies.
Yes, he paid for a C-section for dead puppies because you can't leave them there. They got to come out.
I've seen it way too many times, and then you have to be hopeful that there's no holes in your uterus and she hemorrhages. You know what I mean? But now you have a puppy blocking the way, so you don't know she's hemorrhaging. Like there's so many devil's advocate on both sides. You know, people like, oh, this and this, or this and this. I mean, both of them have their pluses and both of them have their negatives. Yeah. So it's, when it comes down to the brass tacks of things, this is some people look at it like it's an extreme business. When it's an extreme business, it's all about profits. Let's just be realistic, and some people are going to have something negative to say about that, and I understand that. And I'm not saying that's how I feel. I'm just giving you an honest answer. Yeah. So the honest answer is, if I take out puppies, yes, she might not recognize them day 1, day 2, and I have a hard time for myself. Or she might not have the greatest milk because she didn't go into labor.
Well, that was another thing too. So I know from, yet again, firsthand, my son was a C-section. So I know that what the doctor at least explained to us was that the reason why my wife had such trouble producing milk was because of the fact that when the child passes through, it sends hormones to the female to produce milk. So I'm assuming that that's the same when it comes to dogs, that if you do a C-section, that's why a lot of dogs who get C-sections, they have sometimes hard time.
So I know when I worked in the vet's office and we had the dog open, we would put oxytocin directly on the sewed up uterus, like sprinkle it over, right on the actual uterus, and you could sometimes see the uterus like tense up. Yeah. Wow. And there's a thing that you can speak to your veterinarian about. There's a different dosage for oxytocin when the dog has had a C-section versus a natural birth. Oh wow! Because you've already exhausted that uterus contraction, where a C-section, she didn't have to contract her uterus. So you're trying to squeeze it to get a lot of the stuff out, all the
hormone.
No, the actual excess blood.
Okay. Oh,
because,
yeah.
you know, if you've ever been in there with a C-section, they look for puppies. They don't look for blood clots. They don't look for chunks and all that kind of stuff.
Yeah.
They take out puppies. They just feel, oh, there's no more puppies in. Let's sew her up.
Yeah.
They don't flush her out. So they give her oxytocin so she flushes herself out naturally. She contracts. So the blood clots and stuff like that come out her vagina.
Wow.
You know what I'm saying? That's another thing. If you're getting a if you're getting a C-section, I recommend to ask the veterinarian, hey, can you put this, you know, can you put some oxytocin directly on the uterus?
On the uterus, yeah.
I mean, I've physically seen the uterus go like this before, like Pulsate.
You're talking about when the dog like it's still open.
Yes.
And to put
So, you know, the cervix is closed back up. It's sewed back up.
Gotcha.
We would literally take oxytocin and spray it over top of the uterus.
That was at the vet that you used to work at.
Yeah.
Wow.
It was pretty dope, bro.
That's great.
And you could, like I said, you could see it pulsate. Not big, but you could see it like slightly pulsate.
Crazy.
Like almost like a shock, like woo! You know what I mean? And it would be dope. But the other thing about C-sections that I would do at my vet's office, I prefer my breed has tails and dew claws done. Not dew claws, but tails. I'm at the veterinarian. Let's chop these tails off.
Yeah.
I'm already exposing these puppies to this area.
Pathogens, yeah.
Yeah, so let's just cut the tails off so I don't have to bring them back out.
No, that makes a lot of sense.
And a lot of people are like, oh, you gotta wait 3 days. Says who?
Yeah. No, that makes a lot of sense though. And back to what we were saying though, just the whole aspect of just the whole C-section period, like not only the financial part that you mentioned, like as far as more puppies equals more profits, but I also believe that, hey, I mean, even if you're just somebody who's pro-life, I mean, I would think that the puppies have a better chance of survival if you're doing the C-section rather than trying to wait for them to all naturally pass and one gets stuck.
Here's the added benefit to doing a C-section. You have this dog wide open. Hey, vet so-and-so, how does her uterus look?
Yeah.
Is it in bad shape or is it in good shape? Did these 16 puppies that Zaza was out of, did she tear that uterus up? Is it so stretched out that you can see through it like cheesecloth, or is it still viable? Wow. It's an added benefit because now you can physically see it.
You're right.
So it's a double-edged sword. Like I said, you're gonna have those people who are gonna like no, and then you're gonna have those people who live and die by C-sections.
I've just found that, you know, those people who are against the C-sections, if you are breeding long enough, eventually something's
gonna go wrong. Comes out breech, comes out backwards and upside down, comes out. I've had them come out. I've had one try to come out sideways.
Or what about? I mean, not the people who do natural, not realizing there's still a puppy left. You know, and I'm not talking about like stuck. I'm just talking about she's not pushing it or whatever the case may be. Or a puppy dead that's inside of her.
I will say we did a episode about what are some of the great tools to have in.
Yeah,
that is one of the, to me, the sonogram machine. Everybody wants to check to see if she's pregnant. I personally think that it's more useful after she has puppies, so that I can see if there's one left.
Yeah. If she's
empty.
Yeah, if she's empty. Yeah.
That's where I think it's more valuable because again, everybody's done it. I think she's done 2 hours later. Hey, like 1, 2, 3. What the hell? There's one more.
Yeah.
You know what I mean? Because we think she's done.
Yep.
You know, I did an X-ray. I saw 7. Shit, I don't know if anybody's seen an X-ray. Yeah, them things is hard to see.
And I've heard of plenty of times where somebody says, I thought she was done, and next thing I know, I see some green discharge or I see some discharge coming out. Turns out one was maybe dead inside that isn't coming out.
How me and my wife used to do it, we would do, if we did a natural birth, say, you know, they normally go at night. I've always had all my births at night. Yeah. And when I think she's done the next day, I'd take her and, hey, doc, can I just do an X-ray real quick, make sure she's empty?
Definitely.
Yeah, let's see. Oh, yeah, she's done. All right, thank you. You know what I mean? It was easy peasy, 1, 2, 3 easy. You know, now I know everybody's empty. I know she's healthy. You know what I'm saying?
Yeah.
Because if you took the dog to the vet because she had a stuck puppy, they're going to do an X-ray anyway to make sure there's only one.
No, you're right. You're right.
I mean, they're gonna try to get it out. Maybe maybe I shouldn't say it for YouTube, but they're gonna try to take it out, and you know, they're gonna try to get it out whole.
Yeah.
But it might not come out whole.
Well, here's another thing, right? So now we've kind of covered a lot of our perspectives on the C-section and stuff, but now I guess we could talk about this a little bit as far as like timing your C-sections, right? Yeah. So when is let's say somebody made up their mind that they want to do a C-section. when is the best time? And then yet again, for the people that don't want to do C-section, that's perfectly fine. You know, we're not knocking it, but you definitely do want to do some type of confirmation afterwards to make sure
she's empty.
She's empty.
Yeah.
But
I recommend that. I really
recommend. Me too.
Because you can go septic.
Yeah.
She can get sick from the dead puppy, or even the live puppy still in there. There's a whole array of things that can go wrong. So for me, I think C-sections are safer.
Yeah.
As the bigger picture, in my opinion. Now, yes, the mom could pass away on the table. I have very rarely seen
Me
that.
too, very rarely. And yet again, when you're dealing with animals' lives, there's always some sort of risk no matter what you do with anything.
I mean, literally, if I could get C-sections for what I paid in Texas, I would just do C-sections all the time. They'd just be wham, bam, thank you, ma'am, and I'm done.
Yeah.
She doesn't have to...
In some breeds, you have no choice. Like, you have to, like, I believe it's like Frenchies, English Bulldogs, like, you have to do C-sections. You have no way out of it. But we could talk about a little bit about quickly. So say somebody made up their mind and they want to do a C-section. When is the best time? Because it's not like...
I think the textbook answer says that it has to be after day 58. I believe that's the textbook answer.
Yeah, so...
Because of the surfactant.
Well, definitely, I would agree with after day 58, based off of the animal...
I don't think a veterinarian today, this is what I will say, I don't believe a veterinarian today with the progesterone technology that we have now versus 20 years ago, I don't think they're going to do one without a reverse progesterone now.
Yeah, and that's exactly what I was going to say.
And the textbook answer says reverse progesterone should be 2.5 or 3.
It's like a 2 or 3. But here's where I find that there's a flaw in that is a few things. The first thing is, yes, in most of the textbooks of like animal reproduction and endocrinology, it talks about having a C-section after like a 2 or 3, depending on the book you're reading. Or lower, yes. Yeah. But they're going based off of an IDEX machine.
No, I know. I'm just saying, when I say that...
No, I'm just clarifying for them that, like, that's based off of an IDEX machine. So I've had actually someone that I personally know that his Wanfo machine said a 5. Yeah. Well, when he went to the vet, he told him, well, she's a 5. And they were like, no, she needs to be way lower. Well, it turns out damn near, as she was dropping, a 5 on their IDEX machine was like a 3. So as she was a 5 on his machine and dropped to a 3, now a 3 on their machine is damn near a 1. She's going into active labor. So unfortunately,
there is a scale, just like a scale for progesterone to breed. There's a scale. I think it's like 15. I want to say it's like 7 to 15 is 24 hours. 15 to 20 is like 48 hours. I don't know the scale. Yeah. Here's a side note for anybody who does reverse progesterones at home. Please, for the veterinarian's sake, let them know and start low when you're drawing blood. The reason why, because if you blow the veins in both arms, and then they have to put a catheter in, it's fucking hard, bro. Well, so start when you're drawing your blood. You have it tapped off. You can even do 2 what are they called?
2 tourniquets?
2 tourniquets, so you can go lower. You can put one above the shoulder or the elbow, and then you can go one even lower, so you can see a vein lower, and then you can hit the vein. And if you miss, then you can go above.
Yeah, well, so that actually leads me to what I was also going to say is I think that if your vet wants to do a reverse progesterone, like say you did your own progesterones, right? Like I do my own progesterones, but my vet still likes to confirm with his machine he feels comfortable.
I wouldn't fight him.
I don't fight him on it. I'm like, you know what? Take the 65, take the 85, whatever the price is. Like it's a small.
It does suck, but it's a CYA. In the Marines, we used to call it CYA. Cover your ass. He's just covering his ass.
Exactly.
That's because the minute he cuts this dog open, and them puppies are premature, they're bald, you're gonna be cussing him out.
Yeah, you cannot be mad if he's at. It's one thing if he's saying, you know, keep coming every few hours to test or no, but if he wants to do a simple reverse progesterone before doing the C-section, you can't be mad at that. I just let them do it. They feel comfortable. I feel comfortable because hey, I'm getting reassurance. And essentially, what you want to do, just so we can backtrack on the timing, is typically I start around day 57. I start doing my reverse progesterones. And as the numbers come down, that's when it's going to kind of tell you within, you know, you'll have an idea, like you said, you'll have an idea within 72 hours, within 48 hours, within 24 hours, as the numbers come down. Once you reach that 2 to 3 number on like an IDEX, you're usually going to be safe to do your C-sections. And then you'll have some vets who argue whether it's a 3, whether it's a 2.
Yeah.
It's very minimal, in my opinion, those 2 numbers. But generally, when that number comes down, just as you were getting ready to breed the dog, her progesterone numbers are going up. It works the same way. Anyone who tells you they're doing a reverse progesterone test and the price is different than a regular progesterone test, they're both the same. You're doing a progesterone test. Yeah, exactly. So
but I will tell you, there's some other things that people look for. Is the dog nesting? Is she panting? Is her temperature dropping? These are the things that your veterinarian...
Has she eaten in 24 hours?
Now, I will tell you, when I was working at the vet, people would just bring in the dog and they would not tell us that the dog ate this morning. I would tell, this is the things that, like, if I'm trying to help people, I would tell you to tell the vet, hey, I apologize, but she ate less than 10 hours ago, less than 8 hours ago, less than 4 hours ago, because the reason I tell you that, I'm about to stick a tube down her throat. She's going to be upside down. She could throw up while she's, you know, cutting her open. I physically had to drape the dog, I mean, not me, the vet, had to drape the dog, turn it sideways, hold all the uterus in with it cut open, and I had to take the tube out because the dog was throwing up.
Wow.
Because the dog ate that morning. Wow. So if you tell them prior to that, they can give them stuff like Cerum, which will stop the vomiting while she's on her back. So those are the little stupid things, because we don't think to tell the vet, like, hey, just FYI, she ate 2 hours ago. Now, if she wakes up and she vomits, you're mad because the dog, you know, basically choked to death, and we don't know why. She choked on her own vomit. There's just little things that we can tell the vet to help our chances.
Exactly.
So, you know, some of the other things was, I would definitely ask to do the oxytocin. I would ask for some serum. The dog's knocked out. It's easy to draw blood off the dog. Take a little bit of serum home, drop it on the puppy's tongue if you don't have any colostrum, because sometimes when you do C-sections, you don't get a whole lot of colostrum, but your oxytocin will help with the colostrum.
Take the serum. Ask them to draw some extra blood so you have the serum. You know, that's great. Help the puppies get a great head start at life, you know, especially since you already just got a C-section. So they may be, like you said, a little limited on the colostrum, especially if she's not producing milk right away because she had the C-section.
And there is medicines that vets should have on hand that can counteract. I unfortunately have worked at the vet's office where they give the Probal too fast or too much. So Probal is what they use. I'm probably going to get in trouble with some of my veterinarian friends. They'll give Probal is given at like a certain amount per 10 pounds, and you get a vet tech that doesn't know, just gives it all to them really fast. That can affect the puppies. So when we cut the dog open, the puppies aren't waking up. So they should only give enough Probal to where the dog is unconscious, so I can intubate the animal as far as gas. I can put the tube in her throat, hook the gas to her, and then flip her over. We'll just say the dog needs, per the book, 7 cc's, but 5 cc's knocks her out enough to where I can intubate her, tube her, and put the gas on her. That's all I need to give her.
Gotcha.
And if I give her 7 cc's very quick, it can definitely affect the puppies.
Wow.
But there is medicine that counteracts the medicine, like Probal, and it helps wake up the puppies. And there's also like diapram. I can't say the word. I have it at home, but it's really good, and it helps, you know, for airways. It's really good for puppies. And then you can even look into, they have like a pressure point in their nose, so you can actually push a needle into their nose.
Seen that.
It's like a pressure point in their nose. Be vigorous. They've found that doing the chop, it can cause shaken baby syndrome, basically. I still kind of do it sometimes, not just over my head and down anymore, but I do some of it a little bit. I mean, there's a lot of things that you can learn from a C-section. For me, is be prepared for the mom not to be the greatest mom for the first few days. You're gonna have to do a little bit of work. Make sure you have something to keep them warm because they can't regulate on the body heat.
What I found that's a good tip and trick is that, especially like and it amazes me. It amazes me every time I see it, where it's like making those motherly connections start to happen, right? So when I bring her home from the C-section, she's kind of like, what's just happened type scenario.
I mean, just think about it. You go to sleep this big and you woke up with 8 things sucking on you.
Yeah.
You're like, yo, what the hell?
Yep. So what I will say is that it amazes me how, even though she doesn't even really know that she had the puppies, over time, within I would say the first 24 to 48 hours, by me, like, one tip and trick that we've done is, like, when the puppies are first born. And actually, let me backtrack. I like what really makes me feel comfortable with a certain vet is if, like, they tell me, we make sure that we put the puppies on their first feeding. We want to monitor everything first before you take the puppies home, because there are some places that they're just like, we cut her open, here's your puppies, go, bye. Like a vet,
they give you a box. With
they give you a box. So I like, to me, that makes me feel a little bit better when the vet's not in, like, they want.
If they don't know you. If they, I've been to the same vet for 10 years. Okay, if he gives me the box, he knows I know what I'm doing.
Yeah, that's
something
true.
totally different.
That's true.
I like it when they offer me a bag of placentas, personally, because now the mom can eat that and get a little bit of a feel for what's going on. I personally like to get that macromium out. I think I'm saying it. Macromium.
Now you got me messing it up.
I like getting that out. Yeah. I mean, there's a lot of little tips and tricks when it comes to C-sections, but yeah, there's so many I can't even think of.
Yeah, it gets crazy. And like, the last thing that I'll just say too is, like I said, like, back to what I was originally gonna say was just that fact that, like I said, when you see those neurological connections where at first she had no idea what's happening, she's not too really crazy about the puppy, and the next thing you know, like what I'll do is I'll take peanut butter and put it on the puppy's genital so that she'll want to clean the puppy. And then when she starts, she's like, like, I'm doing it for, I'm telling you. So in the beginning, we do it and, like, she's doing it because of the peanut butter. But then she's like, wait, this feels right. Like, I should be doing this. And the next thing you know, she's doing it on her own.
So one thing you can do is iodine on the belly buttons. It dries them out fast.
Oh, that's
fall off fast.
Yeah.
You can stimulate them to use the bathroom. A lot of times, my wife thinks I'm crazy. When I hear a whining puppy, I'll just put some rubber gloves on and I just make it pee, and it shuts right up. Really? That's all you gotta do? Yeah, it shuts right up. I don't know, it's just easy,
So
there's a lot of different things that I know I'm forgetting, but yeah, I let them use the bathroom. I make them use the bathroom. I am very mindful because, like I said, there is some adverse reaction to gas. Yeah. So be prepared. Be prepared. It doesn't always happen. Be prepared for this dog to be aggressive towards you and the puppies.
It's a possibility.
Yes, it is a possibility. Do not take it personal. Yep. She does not understand what she's doing.
I honestly, and I've had tons of litters, I can honestly say I've never had a female be aggressive towards me. Okay, actually once, but she was my partner's dog. She wasn't really my dog. She was fine with my partner though. And then I have seen in instances in the first 24 to 48 hours where they may be aggressive towards the puppies, but it's only because, like you said, they
don't know what's going on.
They don't know.
It takes a while. I like when the vet gives me carprofen. I've seen vets give gabapentin. I'm not a fan. I don't even understand it, but I'm a carprofen person. Give me some carprofen and some antibiotics for the incision sometimes. I don't even think about the things. Mom, I tell you a little secret that I give myself. A lot of people want to feed very high protein and very high fat to moms. I'm not into it because that's a water weight. I like to feed the dog the same from the day I bred her to the day she has puppies. Now, after she has puppies, I promise you, I'll give her the whole refrigerator.
Yep.
I'll give her anything she wants. I'll give her ground beef. I'll give her kibble. I'll give her wet food.
I'll do this though before, like, I'll say the week of that I know she's gonna give birth. I'll usually maybe throw, like, I usually keep her on the same food. Maybe the week before, I'll start introducing maybe some puppy food into her food as well. But one thing that I will do is I'll take, like, the goat milk powder and I'll sprinkle it in her food a little bit. That's what I personally do. But I don't go too crazy, but that's about it. And I mean, overall, like, I think the best advice I could give is don't wait until you're so close to getting your C-section. you know, maybe once you're doing your breeding, or maybe when you're midway through the pregnancy or something like that, you know, don't wait until the C-section to form that relationship with that vet, you know.
Or that dog. There's a big thing. I tell people all the time. I get a lot of people ask me, hey, what do you do? Let me just ask you a simple question. Your wife just has a child. I'm a complete fucking stranger. I walk in you and your wife, your room with your son, and be like, hey, can I see your baby? You're gonna be like, yo, who the fuck is this dude? Yeah. So always remember that this dog, you don't want to be her. She doesn't want to be a stranger. So put her in a nice, quiet, kind of dark place prior to her having her litter. Yep. Because that way she feels comfortable. Exactly. So when she feels comfortable, she's gonna have, you know, a nice relaxing time giving birth. There's so many things like we probably gonna forget, but
yeah, like we were saying, I mean, I think ultimately, you know, one of the biggest things is, you know, go to your vet, right? You know, talk to them and see what their game plan or procedure is when it comes to doing the C-section. I strongly am against vets that if you go for your breeding, right? Say today was the day that we were going to do the breeding, and then they're like, all right, let's pencil you in for your C-section. I believe that the females have their puppies on different days. I don't go based off of, we bred her today, so it's exactly got to be on this day that we're coming in for the C-section, because I found when I've waited for the reverse, sometimes the dogs were earlier than the day that the vet would have said, or sometimes they're later. So I strongly suggest, like I said, talk to your vet, see what the game plan is, make sure they're knowledgeable and it aligns with what your goals are. And
here's the one thing I will tell you guys, it's a little secret. I've had vets in the past. Oh, she had a tear. Do you want me to spay her? You just cut a hole in the uterus. You sewed it up. You can't sew the tear up? Like, you know what I'm saying? Yeah. Like, that's their way of trying to spay your animal.
Well, you're 100% right. So that's another thing that you need to be mindful of. And actually, that's probably one of the more important things, is that when you're getting your C-section, and that's why you want to go to the vet and speak with them. And
it's not like spay and neuter, everything.
You want to go to the vet and see what their, I hate to say kind of like what their motive is, you know, because
I'm not gonna say motive, but what they find important.
Yeah, so yeah, some vets are going to be
anti-breeder.
Yeah, exactly. Some are anti-breeder, some are pro-breeder, some vets are breeders. I know a vet out here that is
some vets don't even care, you know, like they're not judgmental.
So you kind of have to find that out beforehand, you know?
Yeah, I've seen it to where, like, man, I took the dog in. They told me she had a hole in her uterus. She just cut a hole in the uterus to take puppies out. She sewed that hole up. She couldn't sew the other hole up.
Yep. And usually, like I said, I feel like you can usually get a vibe from the vet when you're speaking to them. And that's why I'm such a huge advocate for, you know, it's not a waste of money to just, you know, bring your dog, and even though maybe she's already pregnant, get a wellness check.
I've actually went to a vet with no dog, and I paid an office visit just so I can ask him a few questions.
Wow. See that? Exactly.
And he was like, where's the dog? I said, my questions have nothing to do with the dog. My questions between me and you, and I just want to see where your mindset is before I bring a dog in here, because I am a breeder. I want you to know if you're going to judge me, or if every time I bring in, you're going to be offering to spay a dog.
Yeah. I mean, and there's some vets who, one of the vets that I'm cool with, I mean, similar thing. I brought my dog in, we spoke, he said, hey, here's my cell phone number. Call me if in the middle of Christmas, I don't celebrate it anyway, I'll come and do the C-section for you.
Perfect.
So, you know, I mean, so yeah, moral of the story is, guys, I don't even know if there's a moral of the story. I think it's just more so.
Well, this is everything about so much to learn.
Yeah.
C-section. There's so much to necessarily not learn, but there's so many, you know, things that can go wrong or go right. Yeah. So C-sections are a personal preference, and I do know that people do C-sections as needed. They'll let them go into labor, but if you don't have that vet, like where I live at, Monday through Friday, 8 o'clock to 4 o'clock, I'm perfectly fine. If it's Saturday afternoon, I'm fucked.
Well, whether you're pro,
and there is, hold on, I just want to say one thing. Yes, you can. I know my vet, he's like, we're not open on Saturdays and Sundays. What day did she breed? You know what I mean? They will cut them out on a Friday so they don't have to come in on a Saturday. And that is kind of normal sometimes.
Well, whether you're pro breeder, whether you're pro C-section or whether you're not, this is kind of information that you need to know regardless, because if you get C-sections, obviously you need to know this. If you don't, there may be the day that you will need to get a C-section, and this information will be pretty damn helpful. So anyway, guys, I think that covers pretty much everything, right? So that's everything.
I mean, it's everything I can think of right this moment.
Yeah, when it comes to C-sections, like, that's everything I could think of. I think this is going to be a pretty helpful episode. So anyway, guys, as always, hope this information is helpful. Hope it's useful. See y'all on the next episode. All right.